The government was today attacked for neglecting care homes where COVID-19 infections have run rampant. The Labour leader quoted government advice from Public Health England, which remained the advice until mid-March.
Until the 12th of March, the government's own official advice was, and I'm quoting from it, "It remains very unlikely that people receiving care in a care home will become infected." Yesterday's ONS figures showed that at least 40% of all deaths from COVID-19 were in care homes. Does the Prime Minister accept that the government was too slow to protect people in care homes?
Prime Minister.
No, Mr. Speaker, it wasn't true that the advice said that, and actually we brought the lockdown in care homes ahead of the general lockdown.
But the government guidance for care homes did, until 12th March, say, as Keir Starmer quoted it, it remains very unlikely that people receiving care in a care home or the community will become infected. The Labour leader also asked the Prime Minister about the unusually high number of deaths in care homes which aren't attributed to COVID-19, but which many suspect were triggered by it.
10,000 additional and unexplained care home deaths this April. Now, I know the government must have looked into this. So can the Prime Minister give us the government's views on these unexplained deaths?
There has been, as I say, a terrible epidemic in care homes, but since the since the Care Homes Action Plan began, we are seeing an appreciable and substantial reduction, not just in the number of outbreaks, but also in the number of deaths. And I want to stress
Keir Starmer also questioned why the government had just dropped what was the regular nightly press conference graph on international comparisons for death tolls.
This is the slide of deaths.
A version of this slide has been shown at the number 10 press conference every day since the 30th of March. That's 7 weeks. Yesterday, the government stopped publishing the international comparison and the slide is gone. Why?
He seeks to make comparisons with other countries which I'm advised are premature.
Well, I'm baffled. It's not me seeking to draw the comparisons. These are the government slides that have been used for 7 weeks to reassure the public. And the problem with the Prime Minister's answer is it's pretty obvious that for 7 weeks, when we weren't the highest number in Europe, they were used for comparison purposes. As soon as we hit that unenviable place, they've been dropped.
This was the day the Prime Minister hoped those in England that can't do their jobs from home would start commuting again. Overnight, estate agents were added to construction workers, laboratory workers and others the government hoped would head back to their workplaces. Early figures suggest no giant shift in the numbers yet, in part for some because of childcare issues. And 9 unions joined forces today, calling on the government to step back from plans to start reopening English primary schools on the 2nd of June, because, they said, of safety concerns.
Mary Kelly Foy.
Education unions are clear. There can be no compromise on health and safety. These proposals are ill thought out and reckless.
We all recognise the importance of children being able to return to schools. And sometimes scaremongering and making people fear is really unfair and not a welcome pressure that is to be placed on families, children and teachers alike.
The pressure to get parents and others back to the workplace underlined by GDP figures, which showed the economy contracted by 2% in the first quarter, a quarter that included only 10 days of a shutdown, now in its 7th week.
Well, the Prime Minister did announce that the government is making an additional £600 million available for infection control in care homes in England. The government has also launched a new website for care homes to apply for tests. But this programme has been speaking to care homes across the country, where they say there is still confusion as to when any tests might be delivered and over who has responsibility for them. Our North of England correspondent Claire Fallon reports.
Laughter never left this place. They made sure of it, and they use it to hide their fear. This, they say, is a good day, with their first brief visit from the outside in weeks. But the fear doesn't stay hidden for long.
when it first began.
We were left.
We weren't at the front. We weren't as big as the NHS, but now we can have little things as a green badge to make us feel special. I've worked in this job for 20 years. I've never felt special in it.
It's heartbreaking. You know, we cry, we get up and we walk out the car park and we cry there. We ring each other every night after work and cry to each other down the phone.
Debbie and Lisa have been working together in care homes for 20 years. They told me their fear has been made all the worse by the not knowing that's been caused by a lack of testing.
You're never going to be able to answer, was it COVID, was it not?
I do my best, I wear my PPE. I'm constantly covered with a mask when I'm indoors, with a visor, with a pinny, with gloves, with everything I can do to keep them safe and keep my family safe. Because I don't know if I'm going to test positive. I don't know if I could have had it a few weeks ago. I felt awful for a couple of days, but I put it down to the stresses and the strains we were undertaking here. I'll never know.
Do you think it'll ever leave you, what you've been through the last few weeks?
No. No.
Oh, Calvin.
Sorry.
I'm really sorry.
That's what everyone keeps telling us, isn't it? I'm sorry. I'm sorry you can't hug you. I'm sorry. But, you know, I'm not sorry for me. I'm just sorry. We never got the help we needed. And our families weren't with their loved ones when they died.
2 weeks after we were told care homes in England can have tests for everyone, this week came a new web portal for requesting those testing kits.
The portal just allows you to put your information in to tell them who you are, how many residents you have, and then press go, and then wait to get contacted.
With 7 care homes he's responsible for, Andrew Winstanley told me those making the promises must start delivering.
It's confusing the staff, it's confusing the residents, and it's confusing our relatives, because all it does is they see that same message, they hear that same news, and then they're knocking on our door saying, well, why haven't you done it? Matt Hancock has said it's happening. Why aren't the staff getting tested? Why isn't Mum getting tested? And for us to go back and say, well, we're trying, but we're not getting anywhere. And it's a very mixed message.
According to the Department of Health and Social Care, capacity is available now for any care home workers in England who need a test. Although a document released earlier this week by the government said by June the 6th, all care home workers will have been offered a test. And we have heard from many care homes who say they are still struggling to get COVID-19 testing kits. But for some, the current policy doesn't go far enough.
In the absence of a vaccine, it's about the management of the situation. And if there is a process of regular testing, then the home, all the care homes, my care home, all the care homes in the country can then get back to something resembling, normal pre-COVID. Every day that goes by and we don't have testing for both residents and staff, lives are at stake.
While getting just one test for each person still isn't happening at all care homes. In Bootle, as we filmed, a delivery arrived.
There we have our box though.
Inside, the things so many care homes still badly need. But even with these tests, the fear doesn't leave. At what point do you think you're going to start to worry again?
Now. Right now.
She wants to test every day.
I'll never stop worrying. Because I don't want to bring anything to my workplace. I don't want to take anything home to my family. I don't want to be responsible for making people sick.
Until a test's out that can actually say whether we have had it, we're still like ticking time bombs.